Have you gone through this styloid process? So this is like sharp needle-like projection which is projecting downwards. So styloid process itself may come as 5 marks question also, like 3 marks. Okay. So it gives attachment to 2 ligaments and 3 muscles. 2 ligaments are stylohyoid and stylomandibular ligament, and 3 muscles are styloglossus, stylopharyngeus and stylohyoid. Okay. So this styloid process is laterally crossed by facial nerve. Are you there? Medially, it is.
Oh, sorry, my thing was on mute. I thought I was audible.
Okay. So medially, it is internal carotid artery. Okay. In front, internal jugular vein behind, and in between these two, you will see last 4 cranial nerves will be emerging from jugular foramen. The last 4 cranial nerves are which one? 9th, 10th, 11th, and also
So
12th.
vagus, accessory,
Huh.
hypoglossal,
Hypoglossal is 12th. Accessory is 11th.
and then I think I'm missing the 9th one.
Yeah. So between the mastoid and styloid processes, we have a small hole which is called as stylomastoid foramen, which gives passage to facial nerve and also stylomastoid artery. Okay.
Mm-hmm.
Now coming to infratemporal region, infratemporal fossa. 1 minute. So in this infratemporal region, infratemporal fossa, see this upper line is the roof, below is floor, this becomes anterior wall and this is the posterior wall. Whatever we are seeing like yellow and all, this is the medial wall, and the one which is open is lateral wall. So like that it has 6 boundaries, infratemporal fossa. So this infratemporal fossa we are seeing after breaking which bone?
Uh-huh. We
Zygomatic
break the
arch.
zygomatic.
Yeah, you have seen zygomatic arch is broken here, isn't it? Once you break
Yeah.
this, you are able to see this fossa below the temporal bone. Hence, it is infratemporal fossa. Okay. So now you see, like roof is formed by infratemporal surface of greater wing of the sphenoid bone, yellow in color. This one. This area is roof. Infratemporal surface of the greater wing of the sphenoid, and we know this is the squamous temporal. Floor is open. This is anterior wall, which is formed by maxilla, posterior surface of maxilla. This is the orbit,
Okay.
and there will be a communication like this from behind. There will be a fissure which is called as inferior orbital fissure. So through this anterior wall, you will see there will be a communication between infratemporal fossa and the orbit via inferior orbital fissure. This is the posterior wall which is open. This is the medial wall, and you are finding yellow plate, that is the lateral pterygoid plate. Here also there is a fissure between the pterygoid plate and maxilla bone, hence it is pterygomaxillary fissure. It is communicating like infratemporal fossa is communicating with one more fossa deeper inside, which is called as pterygopalatine fossa. Pterygopalatine fossa. Okay. Then later
Okay.
wall, we have ramus of mandible and coronoid process, which is not shown. The mandible is removed, no here. So we have ramus of the mandible in the lateral wall and the coronoid process where lateralis gets inserted. Okay, so
Okay.
is broken zygomatic arch, and below area is nothing but the infratemporal fossa. You can see this like pterygomaxillary fissure, which is leading to deeper fissure inside. Okay, pterygopalatine fossa. Okay, this would be deeper inside pterygomaxillary fissure and pterygopalatine fossa inside. So infratemporal fossa above it is like communications, it is communicating with temporal fossa. In front it is communicating with orbit through inferior orbital fissure. This is the fissure. Medially, deeper inside, yellow arrow, here it goes inside pterygopalatine fossa through this fissure, that is pterygomaxillary fissure. Contents. What are the contents of infratemporal fossa? See, we have seen temporalis muscle was passing inside the zygomatic arch. Hence, lower part of the temporalis, we have two more muscles of mastication like lateral and medial pterygoid. Here we also have mandibular nerve, maxillary nerve, cauda tympani nerve, otic ganglion. Okay.
Okay.
Sometimes you try to remember better, sometimes very rarely they may ask for 3 marks. We also have maxillary artery here in pterygoid venous plexus. Okay. This is the pterygopalatine fossa. That means deep inside, if you go, you will see this pterygopalatine fossa. Here, to show boundaries is very difficult, and you have to imagine only things. It is a pyramidal space below. This is the orbit. No, this side would be apex of orbit. So below the apex of orbit, we have pterygopalatine fossa. So anteriorly, in front, it is
Okay.
same thing, posterior surface of maxilla. Behind is the pterygoid process, lateral pterygoid process, and this one also, greater wing of sphenoid bone. Above, it is communicating with orbit, same through inferior orbital fissure, where it is when this remembering so many things becomes difficult for you. Leave it. Below, like pterygopalatine fossa, we will have an apex which is closed. It's not communicating. Then medially, this whole thing is medial. If you go more deeper inside, we have perpendicular plate of palatine, which I am unable to show in this picture. That means we need to break maxilla in order to go inside. We need to break lateral pterygoid plate to see inside. Then only we would be able to see pterygopalatine fossa. So medial boundary of this fossa would be perpendicular plate of palatine bone. Nothing but hard palate.
Okay.
Laterally, now the one which is open is lateral. So it is communicating through this fissure. We already know this pterygomaxillary fissure. It is communicating with infratemporal fossa. Okay. So this is whole deeper view. Whatever we have is pterygopalatine fossa. So between maxilla and the lateral pterygoid plate, pterygomaxillary fissure, if you go deep inside, you will be able to see pterygopalatine fossa like this. This is infratemporal fossa. Here we have pterygomaxillary fissure. Inside passage would be pterygopalatine fossa, which would be leading into nasal cavity. Okay, something like three dimensional.
Yeah.
You can actually. So it has 5 openings. 3 openings are there in posterior wall. 1 opening in medial wall. Nobody will ask you this. Don't worry. Now you have a ganglion here, same name, that is pterygopalatine ganglion. That is the important content which you should know. Okay, so this is the basal view of the skull bone, Norma basalis, where we have hard palate. This is the, here you will not understand that pterygopalatine fossa. Leave it. Mm, Pterygomaxillary fissure is very simple anyhow. So it is between the lateral pterygoid plate and maxilla. It is transmitting maxillary artery, third part, maxillary nerve. Here it is very close to the upper jaw, hence we have posterior, superior alveolar. Alveolar means supplying the teeth. So posterior, superior alveolar vessels and nerves to pterygoid venous plexus.
Mm.
Okay, this is
Okay.
maxillary fissure. Okay. See, this is orbit completely. This is the roof, floor, medial wall, lateral wall. So in the floor, if you see, there is a, like above you are finding a fissure, right? Big opening. That is superior orbital fissure between greater and lesser wings of the sphenoid bone. Similarly, below also you are finding a fissure, that is inferior orbital fissure. Okay, so about this, you need not read all these points, but what structures are passing may be asked sometimes, like
Okay.
inferior orbital vessels and nerves, zygomatic branch of maxillary nerve, orbital branch of pterygopalatine ganglion. Okay, So these are all like you can actually see how this maxillary artery is going into pterygopalatine fossa, how this maxillary nerve is going inside the pterygopalatine fossa. So contents are we have maxillary nerve, we have pterygopalatine ganglion, this one, okay, and this is the third part
Mm-hmm.
of the maxillary artery and its branches. Okay, that is all about Norma lateralis. Okay,